I want to talk to you today about something that's easy to mistake for a stomach bug or something you ate, yet that can occasionally be an important and atypical warning from the heart. Unexplained nausea, queasiness, or stomach upset, and when it might, especially with other signs, relate to the heart. Because when we feel nauseated or our stomach is off, we naturally think it's something we ate, a bug, or indigestion, and almost never the heart. Yet nausea can sometimes accompany a heart attack and other heart problems, particularly in older adults and women. So understanding when nausea might be more than a stomach matter is genuinely important. So today I want to explain why the heart can cause nausea, how to tell when nausea might be heart-related, the common stomach causes, why it matters, and what to do with the crucial emergency message in partnership with your doctor and emergency services. And I'll be clear and balanced, because while most nausea is a stomach matter and not the heart, some can be heart-related, even a heart attack, and knowing when to treat it as a possible heart emergency can save your life. In partnership with emergency services, this is about recognizing an easily mistaken but sometimes important warning. Let me start with why the heart can cause nausea, because understanding it makes sense of this surprising fact. The heart can cause nausea and stomach upset for a few reasons. During a heart attack or serious heart event, the body mounts a powerful stress response and the nervous system is strongly activated, which can affect the stomach and digestive system, causing nausea, queasiness, vomiting, or a feeling of indigestion. The nerves involved also connect the heart and the digestive area, so heart problems can be felt as upper abdominal or stomach discomfort. And the lower part of the heart sits near the diaphragm and stomach area, so a heart attack affecting that region can cause symptoms felt in the upper abdomen, mistaken for indigestion. So the heart can cause nausea, queasiness, or stomach upset through the stress response of a heart event, the shared nerve connections, and the heart's position near the stomach, which is why nausea can accompany a heart attack. So understanding that a heart event can cause nausea through these mechanisms is the foundation. So the heart can genuinely cause nausea and stomach upset. Let me help you tell heart-related nausea from a stomach matter, because that's the practical heart of this. While you can't reliably tell yourself, some features help suggest when nausea might be heart-related rather than a stomach matter. Nausea more likely related to the heart is accompanied by other heart attack symptoms, chest discomfort or pressure, breathlessness, sweating, lightheadedness, or pain in the arm, jaw, shoulder, or back. Sudden and unexplained without a clear stomach cause like a bug, bad food, or a known digestive condition, accompanied by a cold sweat, a sense of doom, or feeling very unwell, brought on by exertion, or occurring in someone with heart risk factors, especially an older adult or woman. By contrast, nausea more likely a stomach matter is accompanied by clear digestive symptoms like diarrhea, a stomach bug going around, a clear relation to particular food, or known indigestion or reflux, without any heart symptoms, and following a typical stomach upset pattern. So nausea with chest discomfort, breathlessness, sweating, or other heart symptoms, or that sudden, unexplained, and with a cold sweat or feeling very unwell, suggests possible heart involvement, while nausea with clear digestive symptoms is more likely a stomach matter. So the accompanying symptoms distinguish heart-related nausea. So read nausea by its company and context. So context distinguishes heart-related nausea. Let me stress the atypical presentation point because it's especially important. Let me stress this because it's genuinely important. In older adults and in women, a heart attack can present without classic dramatic chest pain, sometimes mainly as nausea, vomiting, indigestion-like discomfort, sweating, breathlessness, or simply feeling very unwell. So nausea or an indigestion-like feeling, especially when sudden, unexplained, or accompanied by any chest discomfort, breathlessness, sweating, or feeling very unwell, should not be automatically dismissed as just a stomach upset or indigestion, but considered as possibly the heart, particularly in older adults and women. People have genuinely mistaken heart attacks for indigestion, with tragic delay, So this matters. So nausea or indigestion-like discomfort is one of the atypical ways a heart attack can present, especially in older adults and women, making it important not to dismiss. So in older adults and women, heart attacks can present atypically as nausea or indigestion. So sudden unexplained nausea, especially with chest discomfort, breathlessness, or sweating, should be considered possibly the heart. So atypical nausea can be a heart attack in these groups. So don't dismiss sudden nausea with other signs. Let me give the crucial emergency message clearly, because this is where it matters most. Here's the crucial, potentially life-saving message. Treat as a possible heart attack and call emergency services immediately if nausea or stomach upset comes with other heart attack features, chest discomfort or pressure, breathlessness, sweating or a cold sweat, lightheadedness, pain in the arm, jaw, shoulder, or back, or a sense of doom, or if it's sudden, unexplained, and accompanied by feeling very unwell, especially in an older adult or woman. Don't dismiss it as just indigestion or a stomach bug when these features are present, and don't simply take an antacid and wait. Remember that heart attacks can present atypically, so nausea with these features must not be dismissed. So treat nausea with heart attack features, especially chest discomfort, breathlessness, sweating, or pain in the arm or jaw, as a possible heart attack and call emergency services immediately, never just assuming it's a stomach matter. So act urgently on nausea with heart attack features. So heart feature nausea is an emergency. Let me cover the common stomach causes, for balance, because most nausea isn't the heart. Let me be balanced. Most nausea and stomach upset is a digestive matter, not the heart. Common causes include stomach bugs and gastroenteritis, often with diarrhea, something you ate, indigestion and reflux, constipation, which I've discussed, medications, many of which can cause nausea, other digestive conditions, and various other causes. Most nausea, especially with clear digestive symptoms or an obvious cause, is a stomach matter and settles or is treated as such. So please don't take ordinary nausea with a clear stomach cause as a heart concern. The majority is digestive. The point is to be alert to the features that suggest the heart and act on them, not to fear every queasy moment. So most nausea is digestive, from bugs, food, indigestion, constipation, or medications, while the key is alertness to the features suggesting the heart. So most nausea is a stomach matter, but stay alert. So ordinary nausea is usually digestive. Let me explain why this matters so much, because dismissal is dangerous. This matters because heart-related nausea is genuinely at risk of being dismissed as indigestion or a stomach bug, especially since stomach upset is so common. So someone could be having a heart attack felt mainly as nausea and indigestion and wrongly attribute it to their stomach, taking an antacid and waiting while life-saving care is delayed. And, as I've discussed, in a heart attack, time is muscle and lives, so delay is catastrophic. So recognizing that the heart can cause nausea and treating nausea with heart attack features as a possible heart attack can prevent the deadly mistake of dismissal and delay. So this matters because heart-related nausea is easily dismissed as a stomach matter, risking deadly delay in a heart attack, which recognizing the connection prevents. So recognizing this connection prevents dangerous dismissal of heart attacks. So it matters because dismissal can be fatal. Let me be clear about what to do across situations, because the response should match the nausea. So here's what to do. For nausea with heart attack features, chest discomfort, breathlessness, sweating, lightheadedness, or pain in the arm, jaw, shoulder, or back, or sudden unexplained nausea with feeling very unwell, especially in an older adult or woman, call emergency services immediately as a possible heart attack. For nausea with clear digestive symptoms, a stomach bug, bad food, or known indigestion, without heart symptoms, manage it as the stomach matter it likely is, with rest, fluids, and your doctor's help as needed, seeing your doctor if it's severe, persistent, or you're concerned. And if you're ever unsure whether nausea might be your heart, especially with any heart symptoms or in someone with heart risk, err on the side of caution and seek help. So call emergency services for nausea with heart attack features, manage clearly digestive nausea accordingly, and err on caution when unsure. So match your response to the nausea, erring on caution. So respond per the nausea's features, cautiously. Let me paint you a quick picture of how this matters. Picture a woman in her 70s who suddenly feels nauseated and queasy, with an indigestion-like discomfort, a cold sweat, and some breathlessness, but no dramatic chest pain. In the dangerous version, she assumes it's something she ate or indigestion, takes an antacid, and lies down to wait, not realizing she's having a heart attack felt mainly as nausea, and the delay costs her dearly. Now picture her understanding the connection, knowing that the heart can cause nausea, and that sudden nausea with a cold sweat and breathlessness, even without chest pain, can be a heart attack, especially in an older woman. She treats it as a possible heart attack and calls emergency services immediately. She gets rapid treatment, much of her heart muscle is saved, and she survives and recovers. The same woman, but recognizing her nausea as a possible heart attack, rather than dismissing it as her stomach, got life-saving care. That contrast is exactly why understanding this atypical presentation matters so much, especially for older adults and women. Let me speak briefly to those of you caring for an older parent or partner. Understand that the heart can cause nausea and stomach upset, and that nausea with heart attack features, or sudden unexplained nausea with feeling very unwell, can be a heart attack, easily dismissed as indigestion or a bug, especially in older adults and women whose heart attacks can present atypically. Crucially, if a loved one has nausea with chest discomfort, breathlessness, sweating, lightheadedness, or pain in the arm, jaw, shoulder, or back, or sudden unexplained nausea with a cold sweat, or feeling very unwell, treat it as a possible heart attack and call emergency services immediately, not assuming it's their stomach. For nausea with clear digestive symptoms, manage it accordingly, seeing the doctor if severe or persistent. Helping a loved one recognize that nausea can be the heart and act urgently on the concerning kind can be genuinely life-saving. So let me draw this all together. Unexplained nausea, queasiness, or stomach upset, usually a digestive matter, can occasionally be an important and atypical warning from the heart, since a heart event can cause nausea through the stress response, shared nerve connections, and the heart's position near the stomach. Nausea, more likely heart-related, is accompanied by other heart attack symptoms like chest discomfort, breathlessness, sweating, or pain in the arm or jaw, or is sudden, unexplained, and with a cold sweat or feeling very unwell, while nausea with clear digestive symptoms is more likely a stomach matter. Crucially, in older adults and women, heart attacks can present atypically as nausea or indigestion, so such nausea with heart attack features must be treated as a possible heart attack with immediate emergency care, since it's easily and dangerously dismissed as a stomach upset. So call emergency services for nausea with heart attack features, manage clearly digestive nausea accordingly, and err on caution when unsure. So here's what I'll leave you with straight and clear. First, understand that the heart can cause nausea, queasiness, or stomach upset through the stress response of a heart event, shared nerve connections, and the heart's position near the stomach, so heart trouble isn't always felt as chest pain. Second, know the features suggesting heart-related nausea. It's accompanied by other heart attack symptoms like chest discomfort, breathlessness, sweating, lightheadedness, or pain in the arm, jaw, shoulder, or back, or is sudden, unexplained, and with a cold sweat or feeling very unwell, while nausea with clear digestive symptoms is more likely a stomach matter, though you can't reliably tell yourself. Third, know that in older adults and women, heart attacks can present atypically as nausea or indigestion, so don't automatically dismiss sudden, unexplained nausea as just a stomach upset. Fourth, and crucially, treat nausea with heart attack features, chest discomfort, breathlessness, sweating, lightheadedness, or pain in the arm, jaw, shoulder, or back, or sudden unexplained nausea with feeling very unwell, especially in an older adult or woman, as a possible heart attack and call emergency services immediately, never just taking an antacid and waiting. And fifth, manage nausea with clear digestive symptoms as the stomach matter it likely is, with rest, fluids, and your doctor's help. Seeing your doctor if it's severe, persistent, or concerning, and err on the side of caution and seek help when unsure. The heart can signal trouble through nausea, so recognizing this and treating nausea with heart attack features as a possible emergency can save your life, which is genuinely important. So take care of yourself, recognize that nausea can be the heart, act urgently on the concerning kind, and manage clearly digestive nausea accordingly. And because heart-related nausea is easily dismissed as a stomach matter, please treat nausea with heart attack features, especially chest discomfort, breathlessness, sweating, or pain in the arm or jaw, as your reason to call emergency services immediately, rather than assuming it's indigestion or a bug, and see your own physician for severe, persistent, or concerning nausea.